look at a resting membrane of a nerve cell, of a neuron. What is the primary extracellular electrolyte? Primary intracellular potassium. So when you have a resting membrane, when you say resting, we mean we're not saying it's not doing anything. It's just not providing a nerve impulse yet. You have higher concentration of sodium on the outside than inside. Higher concentration of potassium inside than the outside. How's that maintained? Maintained by the sodium potassium pump. Exactly. Now, there are gates here called leaky gates. The leaky gates allow potassium to slowly leak out. Because you have a higher concentration of potassium inside and a lower concentration on the outside, what will it try to do? They'll try to leak out. Same with sodium. If you have a leaky gate for sodium, if you have a higher concentration on the outside than you do the inside, what will it attempt to do? Leak in. As potassium starts to leak out, which is a positive charge, it's going to pull these negative charges next to the membrane. Eventually, that negative charge is going to resist the positive charges leaving, right? So you have a kind of a tension there. You have the chemical gradient forcing potassium out, electrical gradient kind of keeping it in. We can measure that. We can mathematically determine that voltage. We come up with what's called the Nernst equilibrium for potassium, which is what voltage? Negative 90. So if potassium were able to reach its Nernst equilibrium, if we measure the voltage across the membrane, it would be negative 90 millivolts. What is the Nernst equilibrium for sodium? Plus 60 millivolts. What is required for an electrolyte such as potassium or sodium? What is required for them to reach their Nernst? In regard to the membrane, what's required? Open. It has to be freely permeable to the electrolyte. If it's freely permeable, if let's say you get big old gates here so the potassium can simply flow out, then it'll be more likely to reach its Nernst equilibrium. If you shut down those gates, make it harder to go out, you'll reduce the Nernst. What is the resting membrane potential by definition? By definition. Resting membrane potential is the voltage that the nerve is maintaining while at rest. What is the voltage, what is the value of the resting membrane potential? Negative 70. Who remembers why it's negative 70? Partially. Difference between the two.
It had something to do with the inhibitory. So you're talking about
How about this? Which has a higher rate of diffusion, potassium or sodium? Potassium. Remember, potassium diffuses through here 75 times greater or faster than sodium does. So which one is actually doing a better job of reaching its Nernst? Potassium. And since potassium Nernst negative 90, you can be towards that direction. So if you take the Nernst of potassium and the Nernst of sodium, that's where you'd average up to be negative 70. Okay, let's say here's your resting membrane potential. And what value is the resting membrane potential? Negative 70. Let's simply look at potassium now. If you're to increase the diffusion rate of potassium, which means it can leave the cell easier to go towards its Nernst or away from its Nernst. If it can diffuse through the membrane easier, will it go towards its nurse or away from its nurse? Towards. So if you had negative 70 and you make the leaky channel larger, so it goes closer towards the nurse, what will the voltage do? Towards its nurse, right? Which is negative 90, it goes this direction. Therefore, you make the voltage greater or less in the cell?
Less.
Is negative 90 less than negative 70? The greater, compared to 0, you're making the difference greater, correct?
But it's negative. That's
Therefore, you hyperpolarize the cell. When you look at, back up here. When you go to the nurse, forget about the negative sign, because that's confusing. Just think about the absolute, you learn what absolute values are in 050. Is 90 larger or smaller than 70?
90's larger if
So,
you're not looking at the negative.
we're not looking at negative, we're looking at absolute voltage. The absolute voltage, 90 is larger than 70, correct? Therefore, the difference is greater, therefore you've hyperpolarized the cell, made the voltage greater. Let's look at potassium again. If you were to reduce the amount of potassium that can leave, let's say make the leaky channel even smaller, would you go towards its nurse or away from its nurse? Away. Therefore, what will the voltage do? Go towards 0. Would the difference be greater or less than normal? And think absolute. 55 is less than 70, correct? So that'd be a hypopolarized cell. Now then, what is, okay, we haven't got threshold yet. Okay, any question then in regard to the resting membrane potential? By the way, this sodium potassium pump, %70 of the energy that nerve cell uses is maintaining that sodium potassium pump. That's why I said when the cell is at rest, it's not resting, it's very active. That's when it's using most of its energy. It's maintain high levels of sodium on the outside, low levels of potassium, or high levels of potassium on the inside. If we come here to the sodium, and all of a sudden open the gate here, so sodium would have complete and total access to flow into the cell, what would one expect the voltage to do? If you increase the rate of diffusion, do you go closer towards nurse or further from nurse? If you increase the diffusion rate, do you go closer to nurse or further from nurse? Close to nurse. What is the nurse equilibrium for sodium?
60.
So if you're here and you open the gate, what's the voltage going to do? Go which direction? Towards what? Give me a number. Towards 60. Because remember, for nurse equilibrium to really be expressed, you have to have that full transfer to the membrane. So if this were to open up all of a sudden, the sodium can flow in quickly, and the voltage then go towards, or attempt to go towards its nurse. This is the concept we'll look at next in regard to the action potential. Okay, questions?
So, to sum it up, if you increase diffusion, it goes towards its nerves.
Yes.
It's going to seem stupid, I'm sure, but the sodium and the potassium, sometimes you have the positives on there and sometimes you don't, and I've noticed that in the book too. I don't want to seem stupid.
We'll look at that for action potential.